Good afternoon, everybody. So, as a part of integrated teaching program, I will be briefing the anatomy of thyroid gland. Okay. So, the thyroid gland is a reddish brown, highly vascular gland. Okay, it's a endocrine gland, as you know. So, reddish brown color because of its vascularity. Okay. So, some interesting facts regarding this. As you know, this manufactures, stores, and releases the hormone. It depicts the one organ which depends on external environment for its production of that hormone, use of raw material. Okay. So it has one of the gland which has the richest blood supply and first endocrine gland to start develop. If you see the location of the thyroid gland, so it is located in the neck, okay, front and sides of the trachea. You can see there, front and sides of the trachea at the level of C5 to fifth cervical to first thoracic vertebra region. Okay, so that's the extent of the thyroid gland. If you come to the external feature or parts, okay, so this gland they describe it as H-shaped or butterfly-shaped gland, endocrine gland. So it has two lobes, right lobe and left lobe. You can see this, the right lobe and left lobe. So these two lobes are connected by a isthmus. Okay, isthmus. If you go to that each lobe, right lobe and left lobe, so each lobe, so the upper end is narrow, the lower end is broader. Okay, so it's called the apex and the base, and it has two borders. The number one shows the anterior border, number two shows the posterior border. Okay, then if you come to the different, if you see in the cross section at the level of 6 cervical vertebra, you can see the different surfaces. So there number one shows the anterolateral surface, number two shows the posterolateral surface, and the number three shows the medial surface of one lobe. Okay, one lobe. If you come to the isthmus, the connecting part, it's almost quadrilateral in shape, having one upper border, lower border, anterior surface and posterior surface. Both the diagram you can see, your left hand side, right hand side diagram is the anterior view, the left hand side diagram is the posterior view. Okay, sorry, other way around I think. Then if you come to the measurements, the dimensions of that gland, so on an average it weighs 25 gram in weight. Okay, and if you see the length of the lobe, each lobe, it's about 5 centimeter. If you, on an average, if you take the transverse width, okay, it's about 3 centimeter, and anteroposterior width is 2 centimeter average. Okay, the upper end is narrow, lower end is broad. So in case of in pregnancy and menstruation time, the size and the weight may increase a little bit. Now the gland, the thyroid gland. Okay, so as you know, each gland has its own connective tissue that form the capsule. So here we have two capsule. One is the true capsule. Okay, true capsule means it's formed by the connective tissue surrounding that particular gland. Okay, then the outside that true capsule, you have one more capsule called pretracheal layer of deep cervical fascia. Okay, it's one of the part of the deep cervical fascia. We studied the investing layer, prevertebral and pretracheal layer. So one of the layers is pretracheal layer of deep cervical fascia. So this deep cervical fascia, above it will extend up to the hyoid bone and along the midline up to hyoid bone, and on the sides it will extend up to the oblique line of the thyroid cartilage. You know, above the thyroid gland, apex of thyroid gland, it's attached to the thyroid cartilage. Okay, so there is an oblique line. Okay, till there it will extend, and below it will extend into the thorax up to the near the apex of the pericardium, fibrous pericardium. Okay, so till that's the extent of the pretracheal layer of deep cervical fascia. If you come to the medial side of this gland, the pretracheal fascia, okay, there's a connection between the pretracheal fascia and the cricoid cartilage. Okay, so that's called the ligament of Berry. You can, okay, ligament of Berry. That's called the ligament of Berry. So the connection between this your cricoid cartilage and oblique line of thyroid gland, okay, to the pretracheal layer of deep cervical fascia is responsible for the movement of the thyroid gland during deglutition. Okay, that's the one factor. And the between the true capsule, deep to the true capsule, you will have the venous plexus. Okay, so as in surgeries, okay, so while removal of the thyroid gland, along with the true capsule, they have to remove. Okay, muscle. So these are the relation from superficial to deep skin, superficial fascia containing platysma muscle, then the medial most anterior border of the sternocleidomastoid muscle, then you will get sternohyoid muscle, sternum to hyoid, then sternothyroid muscle. Okay, so these are the anterior relations of the thyroid gland. When you come to the posterolateral surface, this carotid sheath and its contents. Okay, carotid sheath and its contents form the posterolateral relations. So it contains the common carotid artery. Okay, the lower level, the common carotid artery, then internal jugular vein. Okay, so in between those two, posteriorly you will have a vagus nerve. Okay, so these three structures form the posterolateral relations of the thyroid gland. Then when you come to the medial aspect, the medial border, medial surface, you will have the larynx and trachea below, posteriorly the pharynx and esophagus. Okay, larynx and trachea in the front, esophagus and pharynx behind. Okay, and cricothyroid muscle in front and inferior oblique muscle behind. Then the two nerves, one is external laryngeal nerves. Okay, so it's a branch of superior laryngeal nerve, the external laryngeal nerve. Then from below you will have a recurrent laryngeal nerve in tracheoesophageal groove between the trachea and esophagus. Okay, so two tube-like structures, two muscles and two nerves. Okay, so these are the medial relations. Then near the, if you see the apex of the thyroid gland, it's almost sandwiched between medially the inferior constrictor muscle, okay, and laterally you will have sternothyroid muscle. Okay, and near the upper pole, superior thyroid, you can see the superior thyroid artery. Okay, superior thyroid artery, along with you will get external laryngeal nerve. Okay, near the upper pole. Near the base, you will have an inferior thyroid artery. Okay, so these are the important relations. Then if you this isthmus region, so anteriorly again superficial, if you come, the skin, superficial fascia, okay, then anterior jugular vein, then you will have a sternohyoid muscle and sternothyroid muscle. Okay, sternum to hyoid bone, the higher up, and sternum to thyroid cartilage, sternothyroid muscle. These are the anterior relations of the isthmus, the connecting part. Okay, posteriorly you will have a second and third ring of tracheal cartilage. You know, tracheal cartilage starting from the C6, lower border of the cricoid cartilage. So the second and third ring form the posterior relation. Along the upper margin of this isthmus, you will have the anterior division of the superior thyroid artery running. Okay, anterior division of superior thyroid artery. Okay, and right and left side they'll come and anastomose with each other. Along the inferior border, you may find sometimes the thyroidia ima artery. Okay, it's occasionally present, thyroidia ima artery. So it's a branch of either brachiocephalic trunk or arch of aorta. Then along the upper border, you may find some projecting, this one, or pyramidal lobe of thyroid gland, small tissue projection, pyramidal lobe of thyroid gland, and sometimes the fibrous band-like structure, it may be fibromuscular tissue. This levator glandulae thyroidea. So these are the relations of the thyroid gland. So after this, these arteries, they will run along with the fibrous septa, true capsule, then along the fibrous septa. So finally they will form a fenestrated capillaries around each follicle, thyroid follicle. If you venous drainage, okay, venous drainage. So from the upper part, it drains into the superior thyroid vein, it drains into internal jugular vein, both on right and left side. Okay, the middle thyroid vein drains into internal jugular vein, right and left side. The inferior thyroid vein usually drains into left brachiocephalic vein. Both the inferior thyroid vein drains into left brachiocephalic vein. Okay. Then you will have one fourth vein called the Kocher's vein. Okay. So that will drain into internal jugular vein. Kocher's vein, the internal jugular vein. So its importance comes during a surgery. Then regarding the lymphatic drainage of the thyroid gland. So around each thyroid follicle, there is a lymphatic plexus will be there. Okay, fenestrated capillaries of lymphatic plexus will be there. So they divide from the upper part of the gland, it drains into jugulodigastric lymph node and prelaryngeal lymph node. Okay, prelaryngeal in front of the larynx, the prelaryngeal lymph node, and jugulodigastric lymph node, where the digastric muscle causes the internal jugular vein. Okay, that's the main lymph node. From the lower part of the gland, it drains into the pretracheal lymph nodes and some of the lymph nodes along the internal recurrent laryngeal nerve. Okay, these two lymph nodes which mainly drains into this lymph from the thyroid gland. Each thyroid gland, if you take a section, so you have a true capsule. From the true capsule, the fibrous septa will runs into this gland. Okay, so that divides into multiple lobules, many lobules. Okay, containing about each lobule contain 40 to 60 follicle. So in that fibrous septa, you can see this blood capillaries and lymphatic capillaries running. This arterial capillary and venous capillaries will be there. So if you go to the each lobule, you will have a follicle, thyroid follicle. So each follicle is lined by cuboidal cell normally. So but the size of the cell may vary. Okay, it may be columnar or squamous, appear to be squamous. Okay, depending upon the activity of the thyroid gland, active thyroid gland. So each follicular cell resting on basement membrane. Okay, the basement membrane, and luminal surface, there is a microvilli. Okay, microvilli. So then, between this basement membrane and this follicular cell, you will have C cell, that parafollicular cell. Okay, so they will never reach to the luminal surface. Okay, they will be between the basement membrane and the follicular cell. Okay? And you will find this capillary plexus around each follicle. So in humans, about 3 million of the follicles will be there. So these follicles may be intercommunicating with each other. Okay, so this is about that brief description of the anatomy of the thyroid gland with the histology. Anything doubts? Anybody? Any clarification?